Hi everyone, my name is Sharon Su and I'm a second year dental student. The study that I will be presenting today is titled A Comparison of Men and Women's Oral Health. We'd first like to thank the Roseman University College of Dental Medicine Clinical Outcomes Research and Education team for the support of this study. To start off with some background, oral health is known to be important to one's overall health and well-being. It can affect your general health, including pain, difficulty eating, etc., and directly links to systemic diseases, which can complicate systemic disease treatment, for example, in the case of oral infections. Oral health can also affect your well-being. Studies show that the loss of self-esteem is associated with loss of teeth and untreated disease, for example, in the case of periodontal disease and caries. Many studies currently exist on perceptions, attitudes, and opinions about oral health between sexes. Studies on social impact of oral health attitudes also exist. However, not much has been explored regarding the specific oral health behaviors between men and women in the United States. The objective of our study is to identify and compare factors related to men and women's oral health conditions. Our methods included data from the National Health and Nutrition Examination Survey of 2017 to 2018. Our variables included demographics, oral health behaviors, and oral health exams. Our statistical approach consisted of performing chi-square tests to examine the relationship between sex and oral health variables, with a significant difference set at a p-value less than 0.05. Here are the results of our study. In terms of demographics, our study consisted of 9,254 participants. 49.2% were male and 50.8% were female. The racial distribution consisted of 34% white, 22.9% Black, 14.8% Mexican, 12.6% Asian, and 8.9% other Hispanic. The average age was 34.3 years old, and 49.2% were married, with the following marital status distribution. 56% had attained some college or above, with the following education level distribution of our participants. And finally, 22.2% reported $25,000 to $45,000 as their annual household income, with 19.4% reporting $100,000 or above. Here are our results with regards to their oral health behaviors. There is a significant difference between males and females when asked about their last visit to the dentist. Females more frequently visited the dentist than males. There was also a significant difference when asked about their reason for their visit. Females were more likely to go in on their own for a checkup, exam, or cleaning compared to males. When asked if during the past 12 months there was a time when they needed dental care but could not get it at the time, there was no significant difference between males and females. Here are the following reasons as to why they could not receive dental care at the time needed. In the first figure, participants were asked how often during the last year they had experienced painful aching anywhere in their mouth. Our results showed a significant difference between males and females, wherein females had more mouth pain than males during the last year. In the second figure, participants were asked how often during the last year they had been self-conscious or embarrassed because of their teeth, mouth, or dentures. Again, there was a significant difference between males and females. Females more often reported that they had been self-conscious or embarrassed. In the third figure, participants were asked to rate the health of their teeth and gums. There was a significant difference between males and females, where males rated the health of their gums more poorly. In the fourth figure, participants were asked whether they thought that they might have gum disease. There was a significant difference between males and females, wherein males thought that they might have gum disease more often than females. This first figure shows when asked in the past 12 months if a dentist, hygienist, or other dental professional had a direct conversation with them about the importance of oral cancer screening, that there was a significant difference between males and females. Females were more likely to have not had a direct conversation about oral cancer screening. In this next figure, when participants were asked about oral cancer screening and whether or not they had it performed, There was a significant difference between males and females. Females more often had had an oral cancer screening performed. There was no significant difference when asked whether or not they have ever had treatment for gum disease, such as a deep cleaning. There was also not a significant difference between males and females when asked if they had ever been told by a dental professional that they might have bone loss around their teeth. When asked about their flossing habits, there was a significant difference between males and females. Females tended to floss more than males in the last 7 days. Here are the results for the dental examination portion. There was no significant difference between males and females on the presence of implants. When looking at tooth number 3, there was a significant difference wherein females exhibited a restored surface more often than males. In terms of root caries, males had more root caries than females. And when given their overall recommendation for care, there was a significant difference between males and females. Females were recommended more to continue with their routine care, while males were instructed to see their dentist at their earliest convenience. However, there was no significant difference in their reason for their care, which included the following: decayed teeth, gum disease or problem, oral hygiene, dentures, partial denture, or plates, no significant findings, or were recommended for some other findings. Our results show that males visited the dentist less, rated their overall health more poorly, were more likely to believe that they had gum disease or gum problems, and were more likely to be told of the importance of oral cancer screening, but were screened less. Males also exhibited more root caries than females and were more likely to be recommended to see the dentist immediately or at their earliest convenience. Past studies have shown that men with poor oral health experienced a higher risk of premature death. Socioeconomic and behavioral factors explain 52% and 44% of mortality risks attributed to poor oral health and being edentulous, respectively. Oral cancer screening can also reduce the risk of morbidity in high-risk patients. Thus, it is important to educate males on their oral health and to motivate our male patients. Our results show that females visited the dentist more often than men and visited on their own. They flossed more regularly and cared more about the appearance of their teeth and mouth. Females experienced more aching over a 12-month period compared to males and were told less frequently about the importance of screening for oral cancer, but of those that were, females were screened more than males. Previous studies have shown that women perceived oral health condition as having a greater impact on their quality of life and as causing them more pain than men. Oral health knowledge was also significantly higher in women in past studies. Our results can confirm both these statements. Women's knowledge and concern of their oral health have positive effects on oral health habits and their dental visits. Our study contains some limitations. The first is that demographic and oral health behavior data were self-reported and subjected to recall bias. The second is that oral health examination data were subjected to variations in dental provider skills and dental instrument accuracy and sensitivity. And finally, this study did not include all gender identifications. Future research to include transgender and cisgender can provide a more holistic overview. In conclusion, sex differences exist in oral health. The sex differences can help us better understand preferences in oral health needs and differences in behaviors. The results of this study can inform educational and interventional efforts to improve oral health outcomes and reduce disparities. And future research on motivations for different oral health behaviors can help direct conversations with patients for more positive oral health outcomes. Thank you.